Welcome back to Living Pain Free with Dr. Marc Darrow. Your calls can be taken right here, right now in the studio. 866-870-5752. Our topic is musculoskeletal pain, basically orthopedic pain. So if you're having knee pain, hip pain, arthritis pain, you want to give us a call right now and talk directly to Dr. Darrow here at the station. And the website is www.lastemcells.com. That's www.lastemcells.com. Lots of information on the website. You can email Dr. Darrow off of every page. And also, when you call us today, you get Dr. Darrow's latest book for free. The title is Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers. And we want to hear from you right here, right now, 866-870-5752. I have lots of lines open for you right here at the station. Give us a call. And you were...
Let me get...
Yeah, you were about to go to a question. Sorry.
Yeah, I like it because it's a little more complicated than we normally talk about on the radio. A person said, I had a microfracture for a talar dome osteochondral defect. Sounds like Latin, because it is.
That was funny.
The pain is returning again now. I'm not laughing about that. I'm sorry. I'm sorry for the person having this problem. It sounds miserable. Would stem cell therapy be effective for my situation? Thank you. Most likely, yes. I mean, I treat osteochondral defects all the time. What is a microfracture? That's when you take a drill and you put the drill bit into the bone and make it bleed. You do several borings, poke holes into the bone, let it bleed, and then a form of pseudocartilage, I'll call it, can grow around it from the bleeding and the inflammation. But why do that when we can do it with just a simple injection with a thin needle, right? Using platelets and stem cells. So, yes, I work on osteochondral defects all the time. What are they? It's the interface between the bone and the cartilage. Osteo is bone and chondral is cartilage. So the most common place we see these is in the medial femur. That's the middle part of the thigh bone where it is at the knee. And we find it very often with runners or people that are very active. And the bad part about it is this defect can theoretically come loose. And that's the scare that the orthopedic surgeons use. Nothing against the orthopedic surgeons. I love them. They do the hardest work in medicine. But they're always painting sort of a negative picture that people need to have surgery, when people who need to have surgery end up coming to me and not having to get it. So I know a lot of people who do come to me do end up having surgery. That's their choice. I tell them not to, but they decide to do it if they think it's the easy way out. They think, I'm going to go in Friday morning, I'm going to get my surgery, I'm going to come out, I'm going to be perfect. And guess what? Most of them come back later. And they go, the surgery didn't work, or it worked for a couple of years, and now it's failing. So be very cautious about getting surgery. If you can do something conservative in medicine, always do that. You don't want to go into a surgery where tissue is being thrown away, taken out and thrown away, and then destabilizing whatever part of the body that is. So I get train wrecks in the office every day who have had surgery, and some of them have seen me before when I've told them not to do it, and some have been people I haven't met before. But all in all, surgery is going to fall by the wayside. As time goes on, more and more people are doing regenerative medicine, and even some orthopedic surgeons now are learning how to do regenerative medicine. But be careful. I would never go to an orthopedic surgeon to get regenerative medicine because they really don't believe in it. They make their living doing surgeries. And nothing I say about surgery is against the surgeons. It's the culture of our medical condition today. The medical culture, unfortunately, as Suzanne Somers says, is surgery and drugs, and we want to stay away from those things if we can help it. We get people who call in the show every week, just like we had Jan today call in, who's 85 years old. We love you, Jan, who said that she was told back in 91 she had to have surgery, and this is, 30 years later, she still hasn't had it. So good for you, Jan. So I think we can probably help this person who has the osteochondral defect in their ankle. And the way you find out is you got to come in and try it. It is a leap of faith for a lot of people who think that surgery is the way to go. But this person already had a surgery. Didn't work. What do you think?
Well, if you have a surgery that hasn't worked, I mean, if it was me, I wouldn't go get another surgery if the first one didn't work. That would be...
You know what? And the statistics actually show that if you've had a surgery and it didn't work, the second one has less of a chance of working. So I get too many people who come in after back surgery, and they say that their surgeon says they need to get another one. And I touch the back and I go, you don't even need surgery. You didn't need it the first time. We can usually heal that, just injections of platelets or stem cells. So it's a strange, strange world we live in, as we all know. Oh, here's a great one. This is right on the subject, if you don't want me taking this.
Oh, yeah,
Anita.
Go for it. I'll just give the
titled,
phone number one quick minute before you start, okay? 866-870-5752 right here in the studio. Give us a call. Lines are open. Go ahead.
So this person writes in an email and says, and by the way, to email me is so simple. Just go to my website, www.lastemcells.com. That's www.lastemcells.com. Every single page on the website has a spot where you can email me. I answer every single one of them. I'm a very busy emailer, day and night and weekends, in between patients. So this email is captioned, fourth surgery. Person says, I'm on my fourth surgery and I can't take the pain anymore. I'm hoping someone could help me. So obviously I don't know this person. The phone number is coming from Chicago. It's a 312, so I don't know if that person took it with them here or if they're still living in Chicago. But we have people fly in from all over the world, and some of them make a vacation being in L.A. They come for the weather, especially people from the hinterlands like Chicago where I grew up. And so you're welcome to come. There are people that come in who I'll do 3 or 4 stem cells within 1 week, within a 5-day period. They'll come here for a week. And it just depends on what the pathology is and how the exam looks. But typically we inject about once every 2 weeks if you're local. If you're from out of town, we're going to do more injections quickly to get a lot of cells in there and do more healing. So they say they're on their 4th surgery. They can't take the pain anymore. What does that mean? The first 3 didn't do the job. Okay? So be very wary of getting surgery. Be very wary of taking narcotics and other painkillers too. They're addictive. And they upregulate the pain receptors. Guess what they do? They give you more pain. How can that work? People come in, I can't live without my narcotics. Well, that's nonsense, because they don't help with chronic pain. I don't mind someone taking a narcotic, an opioid, if it's very short term. They've just had an injury, they need to get over the hump. But once you start taking it for a while, you will be hooked. And everyone goes, well, I don't have an addictive personality. Yeah, you do. Everybody does. You take enough of that stuff and you will be addicted.
It's true. It's true.
There's no way. I mean, it's easy to get off of it if you have someone monitoring you who doesn't let you cheat. You got to do it slowly. And you have to keep your word. I used to put people back in the hospital, back in the day during my training, when the insurance would pay for people being hospitalized to detox. They don't anymore. But I would get people, I had one guy over at the VA who took 30 Percocet a day. And he was still walking around. I don't know how he was.
Wow.
He was a little bit overweight, so he could handle more than most people. Lovely guy, and lots of pain all over. We weaned him off in about 2 weeks, and the way we did that is by giving a solution with the Percocet in it, so it wasn't pills. He couldn't count how many he was taking. And then we would lower the dose daily, and I think it was within about 12 days he was off of it. He didn't know there was no more Percocet in the solution. And I broke the news to him. He said, "Are you kidding me? I'm not even taking it?" Nope. And he felt better. How do you think you feel when you take drugs? Not very good. For several reasons. One of them is you feel bad about doing it. You don't want to let people know. You feel like you're a criminal or something, which is not true. What's the other one? Constipation. My God, these people get so constipated. It slows down the bowel. The other thing is you lose, in a sense, you lose your sanity. You get disoriented. And a lot of people who are elderly start falling when they're on these medications and have worse things happen to them that they had to begin with. So please try to stay off the drugs if you can. I don't like any drugs at all if we can do it that way. Some people need to have drugs. If you're in good shape, you've lost your weight, and you still have hypertension, you better be on an antihypertensive so you don't have a stroke or something until you can figure out a better way. But most drugs, and a lot of people come in overweight and they're taking diabetes medication. They have type 2 diabetes. You don't need that medicine. You need to lose weight. People say, "I can't lose weight because I can't exercise. I have knee pain." Yeah, you can. Stop eating it all. Stop eating the carbs, right? Cut out the carbs, you lose weight. I have a very, very good friend who says he cut out the carbs. He's 300 pounds, and he said he didn't lose a pound. I said, "Well, I love you, but I don't quite believe you." And he says, "Well, I eat big portions." He says, "I eat big portions." And he sent me a food log. He was eating enough for 5 people. You got to eat decently, right?
Yes.
But the carbs are the main killer. Get off the carbs. Not only does it help with weight loss, but it helps with inflammation. Insulin, which jumps when you have a carbohydrate, is inflammatory in nature, and it pulls fluid into the body. When the insulin drops down, when people go ketogenic or Paleolithic, they find themselves peeing quite a bit, and they lose weight very quickly. A lot of it in the beginning is just water weight, but then they start living off of their fat. They eat their fat. They're not even hungry. You can have 800 calorie a day nutritional program and not be hungry at all because you have plenty of fat to live on. Should I go on here, Anita?
Yes,
I've got plenty
it's
of more
interesting.
questions waiting.
Of course.
Yeah.
Yes, I'll give the phone number too. It's 866-870-5752. That's 866-870-5752 right here in the studio, so you can speak directly to Dr. Darrow, and lines are open for you.
All right. So this question is labeled shoulder, and the patient writes, age 74, male, in good health. MRI shows total thickness tear left supraspinatus tendon with muscle retraction of 48 millimeters. No, that must be 0.48. I don't know what it is, because 48 is pretty big. That's 4.8 centimeters, which is like 2 inches. Probable and partial tear of subscapular tendon, probable and complete tear of long head of the biceps tendon, good strength and flexibility, but aching pain at night. Several weeks of physical therapy didn't help. Can stem cells connect complete tear back to bone? What causes aching? Amazing email. Lots of great questions, and thank you so much for emailing me that. So I have tears, as everybody knows who listens to the show, in my right shoulder. I've got a supraspinatus tear just like this guy. I've got a subscapularis tear just like this guy. I don't have this says probable and complete tear. I don't know what that means, but a possible tear of the long head of the biceps. If it were torn, your bicep muscle would look like Popeye the Sailor. It all bunches up. It pulls off of the shoulder and then bunches up in the arm. So you can always tell if someone has a complete tear. That is not a painful situation after the initial event. It's just a loss of strength by about 15%. So usually the only people that have those reattached are bodybuilders who are being photographed and are in contest just for cosmesis. Cosmesis means how does it look? So you don't need to reattach that. It's not a bad idea to do that, but it's a surgery. Anytime you have a surgery, there is a possibility of having a problem. I saw a woman having a hip replacement when I was an intern. I was helping out on the surgery. She died on the table, most likely from the anesthesia. Came in for hip replacement she probably didn't need and died. So I'm not a big fan of surgery after my failed right surgery, my shoulder. Maybe you are. I know people come in, they've had 4 or 5 or 6 orthopedic surgeries and they're looking for another one. I don't get it. But we all have our own predilections for what we like, and what I like you don't have to like. What do they say, Nita? One man's passion is another man's poison, or something like that.
Something like that.
So my point of view is don't get a surgery if you can help it. Some of them come out real bad, even little teeny simple ones, infections and whatnot. So the patient says they have good strength and flexibility. Well, that's a winner right there. Those tears are not doing a lot if they're really even the problem. But aching pain at night, that's the problem. How do we get rid of that? The person may just have a bursitis. We can inject in there. When I inject a shoulder, I use the ultrasound to find the joint and some of the tendons. I can put that needle right on the spot, and we heal most people up who have shoulder problems. Not everybody. What I do doesn't help everybody. It helps most people. So I don't want to say what I do is better than what other people do. I'm just saying it works most of the time. We have research studies we do in the office. We've had 25 students wanting to go to med school who do research for us, and the results come out amazing. The statistics on doing what we do is extremely amazing. Much, much better on the statistics for getting surgery that I've seen. I started out in the surgical line. I wanted nothing else but to be an orthopedic surgeon. After my failed surgery on my shoulder, I quit that. I found this instead. I've been very grateful, been doing it over 20 years, and it's been a very successful practice with very great results. Nice thing about it, if it doesn't work, you can always get surgery later. Hopefully it works. Very good question at the end of this email is, can stem cells connect complete tear back to the bone? They don't need to. Can they? They could. But I don't tell people we're going to connect things back together. We do see things connect back together sometimes. Most people don't care to get another MRI or an X-ray to find out. They go, why would I spend my money doing that or go do it again when I feel good? Right? Most of you people walking around who are in their 50s, 60s, 70s have tears in their shoulders and their knees and don't even know about it. So why do we need to get surgery to fix them if we have pain? Right?
Well, works for me. 866-870-5752. Right here in the studio, 866-870-5752. Lines are open for you to talk directly to Dr. Darrow before we run out of time today, so give us a call. Check out the website at www.lastemcells.com. And remember, when you call today, you still get that free book. If you haven't gotten it already, you want Stem Cell and Platelet Therapy. Dr. Darrow's latest book, subtitled Regenerate, Don't Operate. It has 264 scientific studies.
And a picture of my 2 huskies, Dakota and Bella.
Ah. Okay, so I just
it's also got pictures of all my 5 kids doing sports, which is really cool.
Okay, so I just want to get this straight. Your favorite female on the planet is, of course, your beautiful wife, Michelle. Then Suzanne Summers. Then you've got 3 daughters. Then you've got Dakota, Bella. So that means I'm like number 8?
Well, you're in the running, okay?
Hey, I'm happy I made the top 10, okay?
Yeah, of course. It's so funny because when I said that, I was thinking, Nita's going to get mad at me. Nita, I love you.
I know you do.
You're the best. How many years have we been together, Nita?
We actually just started our 12th year because we started in 2009. And, well, time flies when you're helping people and having fun doing it.
You are an amazing, amazing host. I appreciate you so much. I can't believe it's 12 years with you on the show. We had Dr. Jean, the pharmacist, before, for another 8 years or so before that, because I've been doing the show over 20 years now. Pretty incredible. Time does fly when you're living it up. That's
right. It does. And you can live it up, too. If you're sitting around in chronic pain, you want to give us a call at 866-870-5752. Oh, good. We're getting a call right now. And remember, please do check out the website because there's a lot of science on that website, www.lastemcells.com. That's www.lastemcells.com. And you can also email Dr. Darrow off of every page on the site. And you can watch him performing the treatments on video. So let us go to William in Torrance.
Hey, William, Dr. Marc Darrow, how are you today, sir?
Hi, how's it going?
You know what? You're going to be my favorite patient because the call screener wrote down you have whole body pain. Tell me about that.
Well, I was actually in a car accident many years back, and then, that's what started with the opiate program. And then I had another accident where I woke up one morning and my left leg was completely dead from the waist down, and it was like that for 2.5 years before I finally had like a flicker of function happen with it again, and it slowly but surely kind of just regained itself. But it took 2.5 years to even get any kind of contact between my brain and my leg, telling it to do something.
Sure.
And
did you have a vertebral injury in the lumbar area?
Pardon?
Did you have fractured vertebrae from the accident?
Not that I know of.
What did the doctor tell you the leg was numb from?
I'm not sure that we really came up with a full diagnosis. He diagnosed me with trochanteric bursitis, and I had clonus in both my ankles.
Oh, I'm sorry,
okay.
William.
Go to the website. You got a big story. We can't have time to do it now, but the website is www.lastemcells.com. Call the office if you like at 800-300-9300. God bless you, and thank you all so much.
Thank you, everybody. Thank you, Alex and Suzette. Listen to Warren Eckstein from 11 to 1 on The Pet Show. I'm Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.